She had like 10 seconds left, so hopefully I can have those. Because I really enjoyed this conference or this, workshop, and I took away a lot. I'm Isha-Charlie McNeely. I go by Charlie, from Portland, Oregon. I am a case manager for youth in foster care. I grew up in foster care system myself, 3 years, or at age 3 to age 18. I aged out at age 18, or more so like exited out 18 years. On my 18th birthday, the court was like, okay, you're an adult, bye-bye. Something that stood out to me was definitely Eric yesterday talked about the peer-to-peer mentoring and coaching, and I do that now with the youth that I work with. I'm 26 years of age, and I work with youth that are transitioning from foster care to post-secondary education. And I think that is so important for there to be a lot of focus on peer-to-peer mentoring, just because for me, when I talk to my youth, and I tell them I was in foster care, that rapport is already there, that bond. They come to me with stuff that they wouldn't come to their counselor with, that has multiple degrees and, is educated in that field. They'll come to me because I have a different credibility because I lived those experiences. So I think there definitely needs to be more funding and support around peer-to-peer mentoring and being able to also relate. I am able to relate to the youth that I work with, and they're able to relate to me. And I think there needs to be more culturally sensitive programs around peer-to-peer mentoring, especially from, transitioning to adulthood. And then the next thing I want to talk about is yesterday there was a lot of talk on like resilience and what does that look like? What is that one thing that, makes a youth successful? And I feel like I was a prime example because I have 4 siblings from the same parents, and we were all put in the foster care system, all faced with the same opportunities, all faced the same disadvantages, barriers, and adversities. But I was the only one that graduated, and people always ask me, like, what did you do? Like, as if there was some formula I followed and then supposed to give it out or something. And I'm like, I think there's multiple things. There isn't just one, but one thing that really helped me, because I did grow up in group homes and foster homes, lockdown facilities, any type of placement, like I've been there. And for me, it was permanency and stability. And I think that's really important when youth are transitioning to adulthood, that they leave, or transition with permanent connections and stability. If I didn't have that, finding that at, getting adopted at age 16, if I didn't have that supportive adult in my life, then I definitely wouldn't be where I am today. Permanency is so huge in transitioning. And that leads me to healthy relationships. And relationships was kind of talked about, but more on a surface area, and it's kind of like taboo to talk about. But it's crazy because relationships are like the reasons why, we as humans even exist. And the idea that there isn't like a lot of relationship programs geared to youth that are transitioning into adulthood, and what relationships look like, what healthy relationships look like, what emotional intelligence looks like. There's not a lot of education. So my role models for relationship came from the foster care system and moving around a lot. And so that's how I treated my relationships for a long time. And so that transition phase, 18 to 26 or however, some people are going to stay in that transition phase forever if they do not know how to have or hold a relationship, and healthy ones, and be able to communicate with people that do not look like them or come from different backgrounds. That is so important to teach youth during that transition, or they'll be in transition forever. And my last point was on mental health and what that looked versus grievance and trauma. And when I entered the foster care system, there wasn't really, I feel like, appropriate services given to me. I entered the foster care system and was, told to go to counseling. Based on one evaluation, all of a sudden I have a mental health disorder and taking medication. And for me, looking back, I was grieving. and they didn't know how to, there wasn't services around that. You know, I had a loss. I lost my family. And because I was put into a system and institutionalized, then my case was medicalized, I guess, instead of looking at it as me, you know, acting out because I, you know, lost something, you know. And that mental health is not a constant state. It's fluid. It changes. So also it being time sensitive and revisited. I don't think that any youth should be given a diagnosis off of one evaluation or one act of behavior that they did, that the whole, you know, the whole circumstance, the whole case, their life and where they're at, that needs to be taken into perspective as well. And one more thing, since I have a few more seconds. Relationships nowadays too also look different. And since I was adopted, I was adopted by two people who wanted to co-parent. So I think that's important too, that we don't have traditional. I remember Andrea, she talked about, you know, youth or young adults seeing it's okay to have children before marriage. And that's kind of the reality of our generation. So instead of trying to avoid it, looking at it as like the structure of family, it looks very differently. I grew up with, you know, the last few years of my teenage years with two moms, and people are deciding to co-parent, and you have same-sex parents and things like that. So definitely that funds need to be behind that type of research as well. So yeah.